Did you know there are fruits that actually lower your blood sugar instead of raising it? Most people with diabetes think they need to avoid fruit completely, but that's one of the biggest nutrition myths causing unnecessary restriction in diabetic diets. In this video, I'm sharing 8 surprising fruits that can help control your glucose levels naturally. The last one shocked even my nutritionist, and it might be sitting in your kitchen right now. First of all, we have berries. If you are trying to control your blood sugar levels, did you realize that the little berries that you might be avoiding could actually be your best allies? People who have diabetes tend to avoid eating berries because they believe they are overly sweet and will cause their glucose levels to surge. Because of this widespread misunderstanding, people are missing out on one of the most potent blood sugar regulators that nature has to offer. Berry consumption has been shown to have a surprising impact on glucose levels, according to research. They do not cause an increase in blood sugar but rather aid to stabilize it. The reason for this is because particular molecules known as anthocyanins, which are found in berries, are responsible for actively improving insulin sensitivity. The presence of these naturally occurring molecules improves the way in which your cells react to insulin, which in turn makes it possible for glucose to enter your cells more efficiently rather than lingering in your bloodstream. Different types of this fruit family each have their own set of advantages, which is what makes them so distinctive. Anthocyanins are found in particularly high concentrations in blueberries, which have been demonstrated to have the most direct impact on insulin resistance in research investigations. Strawberries include ellagic acid, which is beneficial for slowing down the absorption of carbohydrates. When compared to other types of berries, raspberries have a higher fiber content per cup, which results in a slower release of sugar into the bloodstream. A study conducted in 2016 discovered that having only 2 cups of berries on a weekly basis lowered the chance of developing type 2 diabetes by 23%. This makes berries one of the most effective natural blood sugar regulators that are currently accessible. The fact that berries have one of the lowest glycemic loads of any fruit is probably even more impressive. This indicates that they generate only a small amount of rises in blood sugar, while simultaneously providing the greatest possible health benefits, such as enhanced glucose metabolism and decreased inflammation. Next, we have the cherries. Despite the fact that cherries are completely absent from the majority of diabetic food lists, this may be the most significant problem with diabetes nutrition guidance. These ruby red fruits are more than simply a delicious choice for a summertime treat. They are also powerful allies for controlling blood sugar levels. Cherries have a sweet flavor, but they contain a special combination of molecules that actually assist lower blood sugar levels rather than raise them. The peculiar combination of anthocyanins, which are the pigments responsible for the red color of cherries, and chlorogenic acid can be credited with producing this unexpected impact. The combination of these chemicals results in an increase in insulin production and a marked improvement in the efficiency with which your cells absorb glucose. Cherries are particularly helpful due to the anti-inflammatory characteristics that they possess. Considering that chronic inflammation is a significant contributor to insulin resistance, which is a fundamental cause of type 2 diabetes, cherries are an effective means of addressing the issue at its origin. Not only can the antioxidants included in cherries combat inflammation, but research has shown that they also protect against cardiovascular disease and other illnesses that are common in diabetics because of their antioxidant properties. Cherry are one of the fruits that have the ability to reduce fasting blood glucose levels by as much as 8% in just 2 weeks, according to studies. This makes cherry one of the fruits that have the quickest acting time for managing blood sugar levels. Cherries, as compared to many other fruits, do not cause a surge in blood sugar, because they have a low glycemic index of approximately 20 to 22, while studies have shown that tart cherries have slightly better results. Both sweet and tart varieties of cherry have their own set of advantages. Because frozen cherries keep nearly all of the same benefits as fresh cherries, you do not need to be concerned about their availability. Coming to most people's favorite fruit, apple. It is possible that the old proverb that apples keep the doctor away is especially applicable to persons who have diabetes. However, this is only the case if they are consumed in the appropriate manner. There are a lot of us who have been peeling our apples for years without realizing that we are throwing away the segment that is the most beneficial for controlling our blood sugar levels. Quercetin is a strong flavonoid that occurs naturally in the skin of apples. It possesses antioxidant characteristics and has the ability to minimize spikes in blood sugar levels and enhance insulin sensitivity. The T.H. Chan School of Public Health at Harvard University states that the skin is the primary location where the majority of the heart protective antioxidants and fiber can be located. The removal of the apple skin results in the loss of these essential properties. Pectin, a type of soluble fiber found in apples, is responsible for the formation of a gel-like substance in the digestive tract, which greatly diminishes the pace at which carbohydrates are absorbed. As a result, apples are an excellent choice for individuals who are managing their glucose levels since they prevent rapid spikes in blood sugar levels after meals. Consuming an apple 30 minutes prior to a meal consisting of rice was found to dramatically lower post-meal blood sugar levels in individuals who had impaired glucose tolerance, according to a study that was published in Foods in 2022. Individuals who have high blood sugar levels may benefit from the soluble fiber and other anti-diabetic chemicals that are found in apples, according to the findings of the study. Although every variety has its own set of advantages, green apples, on average, have a glycemic index that is slightly lower than that of red apples, making them an even more advantageous option for managing blood sugar levels. When you want to get the most out of your apple slices, combine them with a protein like nut butter to further control how your blood sugar reacts. Jumping into oranges, we must know an important fact. There is a possibility that the difference between consuming an orange in its full form and consuming orange juice could be the difference between significantly lowering your blood sugar and significantly increasing it. It is important to note that diabetes education materials frequently fail to take into account this differential. Orange juice has the potential to induce significant jumps in blood sugar levels. However, eating whole oranges can actually assist maintain stable blood sugar levels. The answer lies in the amount of fiber that is there, particularly in the white pith that a lot of people usually throw away. These fibers perform the function of a natural braking system, reducing the rate at which sugar is absorbed and limiting the dangerous spikes in glucose levels. Oranges are loaded with a potent trio of chemicals that, when combined, have the ability to enhance the way in which your body uses insulin. Oranges contain a natural defensive team against inflammation that is comprised of vitamin C, hesperidin, and naringenin. Additionally, oranges improve insulin sensitivity with their presence. These substances have the ability to improve the efficiency with which your cells use insulin, which in turn enables glucose to travel from your bloodstream into your cells, where it should be. When compared to consuming the same quantity of carbohydrates as orange juice, eating an entire orange results in a blood sugar response that is 77% lower. This is a stunning fact that has been revealed by research. On account of this, it is one of the most striking distinctions that may be observed in any cuisine. Oranges have a particular type of fiber that promotes the growth of healthy bacteria in the gut, which is another advantage. Microbes that are beneficial to the body boost glucose metabolism, which results in a double benefit for the regulation of blood sugar levels. Oranges, which have a glycemic index of approximately 43, offer a large amount of nourishment without the sugar spike that is associated with many other fruits. Pears might be the most underrated fruit for diabetes management, containing a special type of fiber that few other fruits provide. While they often get overlooked in favor of more popular fruits, pears deserve more attention from anyone watching their blood sugar. Pears include an unusual combination of soluble and insoluble fibers, which generates a very powerful effect. While most fruits aid with blood sugar to some degree, those that contain pears have a particularly potent effect. Each medium pear has around 5.5 grams of fiber, which is an important nutrient for maintaining healthy blood sugar levels. The combination of pectin and hemicellulose fibers found in pears allows for a gradual and consistent release of glucose into the bloodstream. Pears contain both of these types of fibers. In the digestive tract, the pectin causes the formation of a gel-like substance that slows down the absorption of sugar. Meanwhile, the hemicellulose contributes bulk and further assists in the regulation of blood sugar levels. The skin of pears includes phenolic chemicals that are unique to them and help block enzymes in the small intestine that are responsible for the digestion of carbohydrates. You will experience a more gradual rise in blood sugar after eating as a consequence of these substances, since they make it more difficult for your body to convert carbohydrates into glucose. It was observed in a study that was published in the American Journal of Clinical Nutrition that eating pears on a regular basis lowered the chance of developing diabetes by 18%, which is greater than practically any other fruit that is readily available. In comparison to fully matured pears, those that are slightly underripe have a glycemic impact that is significantly lower. This provides those who have diabetes with a simple method to further modify their reaction to blood sugar levels, while still being able to enjoy this fruit's nutritional value. The next one can even increase your glucose levels to new heights. Many people don't even realize avocados are technically a fruit, and they might be the single most powerful fruit for blood sugar management. Often thought of as a vegetable, this creamy green fruit offers unique benefits for anyone watching their glucose levels. In contrast to the majority of fruits, which are mostly composed of carbs, avocados defy all expectations with their one-of-a-kind nutritional profile. The amount of carbs that are contained in a half avocado is approximately 8.5 grams, while it offers nearly 30 grams of healthy fats. The majority of these lipids are monounsaturated fats, which have been associated with improved glycemic control in individuals who currently have type 2 diabetes. When consumed in conjunction with other foods, these beneficial fats actually serve to slow digestion and reduce increases in blood sugar levels. The addition of avocado to a meal helps to lower the total glycemic impact of the meal, which results in a more gradual release of glucose into the bloodstream. Additionally, avocados contain rare plant chemicals that, according to study, have the ability to either limit the absorption of glucose or improve insulin sensitivity. The combination of these compounds' high fiber content and their ability to decrease blood sugar increases after meals is a significant benefit. According to studies, incorporating a half avocado into a meal can minimize blood sugar rises that occur after a meal by as much as 50%, which is more than any drug or supplement that is available without a prescription. According to the American Diabetic Association, avocados are considered to be a diabetes superstar food. As an additional advantage, avocados help reduce abdominal fat in particular, which is directly linked to insulin resistance. This creates a double advantage for the long-term control of blood sugar levels. Hold on, because next fruit has some more advantages. This fuzzy little fruit might look unassuming, but kiwi contains a unique enzyme that actively helps process sugar in the body. While many fruits only indirectly help with blood sugar through their fiber content, kiwi contains actinidin, a special enzyme that actively improves protein digestion and slows down how quickly carbohydrates are absorbed. From the perspective of the American Diabetes Association, the kiwi fruit is classified as a low glycemic fruit, which indicates that it has a relatively minor influence on the levels of sugar in the blood. Because of this, it is especially well suited for persons who are managing their diabetes. The kiwi fruit, which has a glycemic index of only 50 and a glycemic load of 7.7, does not exhibit the rapid rises in glucose levels that are associated with many other fruits. There is a higher concentration of vitamin C in kiwis than there is in oranges, which is another reason why they are so stunning. Because it protects pancreatic cells from damage that could interfere with insulin production, this high amount of vitamin C contributes to an improvement in insulin sensitivity. Alpha-linolenic acid, an omega-3 fatty acid, is found in the microscopic black seeds of the kiwi fruit. This fatty acid helps lower insulin resistance and inflammation, which makes it even more beneficial for maintaining good blood sugar levels. Consuming 2 kiwis on a daily basis for a period of just 12 weeks has been proven to enhance insulin sensitivity by 32%, which is comparable to the effects of many prescription drugs. This is a strong argument to include kiwis in your diet. The skin is typically discarded, despite the fact that it contains 3 times the amount of fiber that is found in the flesh and considerably boosts the benefits that kiwis have for blood sugar when they are ingested. Grapefruit has been known for its weight loss benefits, but its blood sugar effects might be even more impressive. This tangy citrus fruit offers powerful benefits for glucose control that many people overlook. Although grapefruit can have a negative interaction with some drugs, it is important to note that grapefruit includes components that significantly boost insulin effectiveness for individuals who are not taking these medications. According to the American Diabetes Association, grapefruit is a fruit that is suitable for diabetics, and there is a strong explanation for this recommendation. The flavonoid known as naringenin, which is found in grapefruit, is responsible for activating insulin signaling pathways and so assisting cells in more effectively absorbing glucose. Because of its ability to improve insulin sensitivity, this unique molecule is an excellent addition to a diet that is suitable for diabetic nutrition. When grapefruit is consumed after meals, the specific organic acids that it contains inhibit the emptying of the stomach, which results in a much more gradual release of sugar into the circulation. This assists in preventing sudden rises in the levels of sugar in the blood. The grapefruit, which has a low glycemic index of only 26, will not produce significant increases in glucose levels after consumption. In a trial that lasted for a period of 12 weeks, researchers discovered that consuming half a grapefruit before meals reduced insulin levels by 28% and A1C by 5%, which is comparable to the effects of several drugs used to treat diabetes in the first line of treatment. Lycopene, which is found in red and pink grapefruits, is an extra benefit that makes these fruits beneficial. These kinds are especially advantageous for those who have diabetes because they contain a potent antioxidant that offers further protection against oxidative damage, which can make diabetic issues worse. These 8 fruits don't just prevent blood sugar spikes, they actively lower blood sugar through different mechanisms. Berries improve insulin sensitivity, cherries reduce inflammation, and apples slow carbohydrate absorption. Remember that portion size matters when eating fruit. According to the American Diabetes Association, a serving of fruit should contain no more than 15 grams of carbohydrates. For most fresh berries and melons, this equals about 3/4 to 1 cup. Try pairing these fruits with protein or healthy fats to further reduce their impact on blood sugar. The protein and fat slow digestion, preventing rapid glucose spikes. Making these fruits part of your regular diet could improve your diabetes management naturally.